everybody. At the end of the webinar, we'll display contact information. You can contact us via phone or email, and we look forward to handling all of your questions in the near future on anything we discuss today. So in the interest of time, why don't we go ahead and get started? Here's our agenda. What we're going to be doing, I'm going to introduce payroll systems for anybody who's not familiar with our company. Also want to introduce our guest speaker who's going to be presenting today. We're going to provide a high-level overview of the San Francisco Healthcare Security Ordinance. I'm going to talk about the options that are currently available from the city. We'd also like to introduce an alternative plan that we're offering through our partnership with the Boone Group and Transamerica Employee Benefits. We'll show you the benefits provided by this plan and discuss a little bit about how this plan differs from the city plan. For our current payroll systems clients, we're going to go over the payroll systems Spend Smart report. This is a custom report that's available at no cost to any of the clients that we currently process payroll for. And this report will dramatically reduce the administration time necessary for the plan. Once again, we'll provide full contact information at the end of the webinar, and we look forward to talking to you further about this and handling any questions that come up. So for anybody not familiar with payroll systems, we've been a leader in Bay Area payroll, consumer-directed healthcare plan administration, as well as complete HRIS platforms over the past 25 years. We are truly a workforce management focused company. We have hundreds of clients in San Francisco and are very, very familiar with this territory and all of the challenging requirements of doing business in the city. I'm very happy today to have a special guest, and that's Brad Billick from the Boone Group. Brad's going to offer his expertise on the topic today. Brad's the Senior Regional Sales Director for the Boone Group. He's been with Boone for over 16 years, handling sales and business development throughout the western United States. Prior to the Boone Group, Brad worked for a consulting and investment banking firm. So thanks again, Brad, for joining us today. And with that, I'm going to turn it over to Brad to go through the San Francisco Healthcare Security Ordinance, the city options, and then to bring into our plan and discuss more details about what we're offering.
Matt, thank you very much. Appreciate the kind words and the introduction. First thing I want to talk about is probably stuff that most of you know, which is that for 2017, the city raised the rate to $2.64 an hour for groups with more than 100 total employees, and to $1.76 per hour for those with 20 to 99. As you probably are aware, that is not the number of employees in the city. That is total number of employees in the company. And as I like to describe it, I call them belly buttons, because whether you're a part-timer or a full-timer under HCSO, you count the same way. One of the things that we also want to mention is obviously for nonprofits. Nonprofits are exempt if they have less than 50 total employees. It's a little kind thing the city did for somebody at least. You know, with our plan, the nice thing is there'll be no more reporting to the employees. The only thing you'll be responsible for is your annual report to the city of San Francisco, because there are no balances that you need to maintain and report to the employee. I don't think I have control. Matt, next slide. Thank you. One of the things about our plan that we are proposing is that it provides minimum essential coverage. Now, under the Affordable Care Act, which I know we're all hearing discussions in Washington, you know, the House passed some bill yesterday that maybe will change things. But for the moment, the law of the land is that if you don't have minimum essential coverage, that you'll be subject to a $695 penalty. That's the individual mandate. A lot of people say, if you've been watching the news in the last 24 hours, that the battle between the Senate and the House will continue for some time. So most people don't see this thing going away this year. And even if they do come to some agreement, no one really knows what that looks like. So the nice thing about our plan as opposed to the city plan is that our plan eliminates that $695 penalty to your employees. We also include dental in our plan, something the city does not. We have a PPO network, which means that employees have choice. They're not required to go to the city facilities or have no network at all if they live out of the city. It's called the First Health PPO network. There's actually a typo there. It says FIST PPO network. It's actually the First Health PPO network. And it's got about 6,800 doctors and 11 hospitals within 20 miles of downtown. We have a prescription network also, which uses all the major pharmacies in the country, CVS, Walgreens, Target, etc. Our plan includes telehealth, which is really a nice feature because you can pick up the phone, call a doctor 24 hours a day, 7 days a week, no copay, no cost. And one of the interesting little tidbits about this is the telehealth benefit is a family benefit. So even though the plan only covers the employee as required under HCSO, the way the telehealth benefit is filed, if you have kids or a spouse, you can actually call, again, 24 hours a day, 7 days a week, speak to a licensed physician about your children. Your spouse can call. They can pick up the phone, the physician, call the pharmacy, call in a prescription for you. You never have to leave home except for to pick up that prescription. So that's kind of a nice thing. We also will cover employees that are eligible for Medicare and Medi-Cal, something the city won't do, as well as, we did mention the PPO network, but you can go in or out of network. So again, you just have as much choice as you'd like to with our particular plan. Matt, you want to move on to the next slide? Mm-hmm. One of the things is that payroll systems brings to the table, which is quite nice, is they mention these reports that they will do for their clients. Because they're your payroll vendor, they have all the hours information, and they're going to be able to send you a report that is ready for you to look at and just forward to us. You won't have to do anything because payroll systems, being your payroll vendor, has all the hours that you're required to spend on health care under HCSO. So that's one of the great advantages of using payroll systems and the Boone Group together. We cover all part-timers and all full-timers not on another corporate sponsored plan. So what that basically means is, unlike the Affordable Health Care Act, which basically is an offer of coverage requirement, San Francisco, as you know, is a spend requirement. So if you offer a full-timer, Kaiser, Blue Cross, United, Cigna, doesn't matter, and they don't take it, you're still required to spend the money. So our plan covers all the part-timers and full-timers that are not on another company-sponsored plan. Of course, there is the San Francisco waiver. If someone has signed it, obviously that would count. One of the nice things about our plan is you will never overpay or underpay your requirement, because our carrier, unlike a Kaiser, Blue Cross, United, which has a fixed monthly premium for their plan, our plan has an hourly rate. So just like the city, we will accept a variable premium. So if your employees' hours fluctuate, the premium fluctuates, because all you're doing is taking the hours times $2.64 or $1.76. Now, you don't know how many hours your employees work until they work. So the beauty of what we do is we use May's hours report to determine June's premium. June's hours determine July for August. So payroll systems obviously has all that data. They know how many hours your employees worked in June. So they will then send you a report that says, here's what you need to spend. You forward that on to us. That report is your invoice. You're self-reporting. We don't invoice you because there's no point, because that report that you'll be forwarding to us from payroll systems shows what the premium is. So again, the beauty is that you're never overspending, which nobody ever wants to do, and you're never underspending, because underspending would put you out of compliance, the amount you're required to spend with the city. Also, our plan treats people who live in the city and outside the city exactly the same. So unlike San Francisco, where we have one set of benefits for those who live in the city, another set of benefits for those people who live out of the city, for us, everything is the same. So what I want to do is talk a little bit about the plan, if I can. So the first part we talked about briefly a minute ago. This is the wellness benefits. Under the Affordable Care Act, they must be provided at 100%. In other words, there is no copay and no cost to your employees if they go in network. And again, we mentioned the network. There's about 6,800 doctors and 11 hospitals within 20 miles of downtown San Francisco. And to further that point, it's a national network. So there are, I think, over 500,000 doctors nationwide. So in other words, if one of your employees happens to be out of state, they get sick, they fall off a ladder, they break their arm, they can look up a doctor in the network, and they can go. Unlike the city, if you live in San Francisco and you're required to use the city hospitals, you literally have to drive or fly back to the city to get a cast on your broken arm. So back to this top part of the plan here. These are the wellness benefits. These are your annual physical, your mammogram, your prostate screening, your AIDS test, your cholesterol test, your EKG. There are like 26 different things that you can get that are 100% paid for by the plan. So I wanted to mention that. It also mentions the MD Live, if you look towards the bottom there, telehealth services, which are included in the plan. And again, under the Affordable Care Act, there can be no lifetime maximum on this particular part of the plan. So again, as it says, wellness benefits are covered at 100%. The next part of the plan is provided by Transamerica. All familiar with Transamerica, big tall building downtown San Francisco. This is an indemnity plan. And this is the part of the plan that covers your doctors and your prescriptions and your surgery and some hospitalization, etc. So the way the plan works is it's broken into 3 classes, Class 1, 2, and 3. Now, Class 1 says 1 to 90 hours. The reason it says that is that's the way the plan is filed. But we all know in the city of San Francisco, you are not required to spend money on anybody that works less than 8 hours a week. So that's 32 hours a month. So Class 1 for us is really 32 to 90. Class 2 is 91 to 130 hours, and Class 3 says 131 plus. But in San Francisco, we also know that you only have to pay up to 172 hours. You don't pay on the 173rd hour. So Class 3 is really 131 to 172. There are other ordinances around the country that literally go down to 1 hour and have no cap. So that's why the plan is the way it was filed. But don't worry, in San Francisco, again, we're never going to have you spend money on people you don't have to spend money on, those that work less than 32 hours. And we're never going to have you spend money on anybody working over 172 because we want to match the rules of the city. So let's do this. Let's talk about Class 2. Go back just 1 second, if you would mind, Matt. Let's talk about Class 2, okay? The plan pays in 3 ways. If you go in network, we will pay the provider directly. So what do I mean by that? Let's say the doctor charges $150, but his PPO negotiated discount is $100. So we're going to pay the provider $70. You're going to pay the provider $30. If you go out of network, which I told you you're allowed to do, you're going to have to pay, just like any other plan, whatever the doctor charges. So if the doctor charges $150, you went out of network, that was your choice, pay the $150, send us the paperwork with all the different CPT codes. Every doctor uses the same codes by law, and we're going to send the member, your employee, a check for $70. But here's the third way the plan works, and this is something that makes us very popular. If you have an employee that happens to have another plan, spouse, parental, exchange, doesn't matter, and they have, let's say, a $25 copay on their plan, pay the $25, send us that same paperwork with the CPT codes, and we are going to send you a check for $70. You get to pocket the difference. Why? Because that's the way the plan is filed. We have no choice. Prescription drug in the middle of the page right there, those are, again, not copays. We pay $15 for a generic and $30 for a name brand. What does that mean? Well, you guys probably know, you have insurance yourselves. You go to get a generic, it's $5 or $10. Well, that means you're going to get it for free because it's less than $15. We're then going to send the member automatically, they don't have to do anything, a check for the balance, because if the prescription was $10, they get it for free, and we pay $15, we actually send the member $5 in the mail. Name brand works the same way. We pay $30 for a name brand. If it's 30 or less, they're getting it for free. If it's more than 30, we pay the pharmacy 30, the member pays the difference. You can slide to the next slide there, Matt. Thanks. I want to point out hospitalization, because hospitalization, little different. You'll see right there it says daily in-hospital benefits. Again, look at the middle class. It says $1,450 for 31 days. If you skip down two rows, you will see hospital confinement benefit, $1,500 for 1 day. So what that means is you're getting $2,950 for the first night in the hospital, and then you're getting $1,450 for the next 30 days. If you happen to slide over to Class 3, you'll see $1,750 for 31 and $2,000 for 2. That means the first 2 nights in the hospital, you're getting $3,750, and for the next 29, you're getting $1,750. Now remember, I'm going to repeat it because it's important. If they go in network, they get all the PPO network discounts that the hospital has negotiated with First Health. We then send the hospital the money directly. If they go out of network, the advantage they have is we will then send them a check. If they have other coverage and they have a $500 deductible and they're in the hospital for 2 nights and they're Class 3, we're going to send them $3,750 for 2 nights. That's 70, whatever it is, $500. We're going to send them that in the mail, and the employee would get to cover any difference in their pocket. If you slide down a little bit on that same page, you'll see that it includes an accident benefit. Just want to highlight this real quick. Guy falls off the ladder, falls off his bike. Gal falls off the ladder or her bike, whatever it might be. They break their arm. They've got the doctor visit benefit. They've got an x-ray benefit that was on the previous page. And the doctor says, hey, you need a cast. This $700 goes towards the cost of the cast. We mentioned the First Health PPO network. I also want to mention dental. This plan has $2,000 worth of dental coverage. Okay, the city plan has 0. The beauty of the dental coverage is it covers all your routine dental day 1. Okay, this on the effective date, cleanings, cavities, x-rays, etc. Okay, after 12 months, you qualify for your major dental, your root canals, your oral surgeries, and whatnot. The plan uses the Carrington Dental Network. I believe there's over 100 dentists just in the city alone that are part of the Carrington Dental Network. And so that's something that obviously is very valuable to employees. Their health, everybody says getting your teeth cleaned and having healthy teeth can lead to and avoiding other major health problems. And so we believe having dental coverage is great. There's one place that our dental plan can potentially save you money, okay? If you have an existing dental vision HRA from before that's in its 2-year rundown period, if someone doesn't have dental coverage, they go to the dentist, let's say they need x-rays, they have a cavity, they get a cleaning, and say it's $500. They're going to send that $500 bill to your HRA to get reimbursed. Well, if they have our dental plan, of which it covers 100% for certain things, 80% for other things, Let's say for that same procedure, their out-of-pocket is only $100. Well, guess what? They can only send a $100 reimbursement to the HRA administrator. So potentially, during the rundown period, about $400 was saved in that example. Okay? As you can see at the bottom, this particular plan sample is $2.64. There is a $1.76 version, as we mentioned, works exactly the same. Benefits are a little lower, obviously, because you have less premium, $1.76 times the number of hours versus $2.64. You want to slide on, Matt?
I think we're going to get into the reporting next. So thanks, Brad, for the great explanation there. Let's talk a little bit about reporting, and then we're going to wrap up today's webinar. So typically for reporting that's required for an hourly based plan such as this, it can be very, very painful for the employer, kind of a tedious process every month. Since the data that's required, employee demographics, employee start date, hours worked during the reported period are all within the payroll software, we've worked with the Boone Group and we've worked with Transamerica to create a custom report, and we call that report SpendSmart. This report's available for no charge to any payroll system client because the data is right there for us already. The idea is it's just going to dramatically reduce the reporting and your time spent every month to submit your information to the Boone Group. So I'm going to bring up what a quick example might look like. Here's an example of what the SpendSmart report would look like. Okay. You'll see the basic demographic information there. I've anonymized some information for the purpose of the slideshow here. And basically, this report will get automatically sent to you every month. You can review it, and then you can submit this to the Boone Group. And as Brad mentioned earlier, this report actually acts as your invoice for the plan. Okay, so you're never going to overpay or underpay. It's going to be based specifically on the hours worked that month for your group of employees. So kind of nice. And this, again, there's nothing to be done for this. It's just automatically sent to you, literally a quick review, and forward this on to the Boone Group. So your time and effort to administer the plan is usually minutes per month. So with that, we're going to summarize our topics for the day, show you our contact information for any future follow-up, and then we'll conclude the webinar. Brad, do you want to go ahead and give a quick summary of
Sure, that'd be my pleasure. Thank you very much. Again, one of the real keys here of doing business with payroll systems is the fact that they're going to put the reports together for you. Other clients that we have, and just so you know, we've sold and written about 90 companies in the city, some with payroll systems, some without. Those without have to put together those monthly reports on their own. Not that that's a huge thing, but it is a thing. The nice thing with payroll systems is they do that for you because they have all your payroll data. They put it in the exact format we need. They send it to you. You take a glance at it. You forward it on to us. You're done. So it's kind of great. Again, we satisfy the individual mandate. We're essentially saving your employees in 2017 $695 in extra taxes. It's almost like a bonus because if they don't have other coverage, they will have to pay that penalty when they file their tax returns, even if they're a low-wage earner. With the city option, the only way they satisfy that mandate is if they go out and they buy other coverage in addition to the money you're sending over to the city. It says we can satisfy Q1 2017 HCSO requirements. That was true up until this last Monday, May 1st, because we can backdate to the beginning of the quarter. So really what that means going forward is we can write a case any month throughout the year, and we can backdate within any quarter to the beginning of the quarter because that's what the city of San Francisco allows. So all the way through July 31st, we can backdate business to 4/1 because the city allows you to send in your 4/5 and 6/1 payment through July 31st. Now, going forward, we're a monthly plan. We don't allow you to send us at the end of the quarter each month, but for this, just to get started with us, we will allow you to pay us in arrears to get yourself in compliance before we move forward on a monthly basis. Again, no city residency requirements. We treat people in the city, outside the city exactly the same, so all your employees have the same plan. We have a PPO network. We have an RX network. And again, I mean, as much as this law is sort of a thorn in everybody's side, we do match the spend requirements, so you're never going to overpay a penny. You're never going to underpay and find yourself out of compliance. And so I think, and lastly, the real key is ease of administration. We do everything. All your employees are spreadsheet enrolled. There is no enrollment form. There's nothing they have to fill out. There's no payroll deductions. There's no dependents to add. So the bottom line is the report that payroll systems puts together is their spreadsheet eligibility, which enrolls them in the plan. We then go straight to a post-enrollment kit, which includes their ID cards and their benefit summaries and a welcome letter, and we mail that directly to the employees' homes. Of course, if you want us to send them to you, we can, and you can pass them out. But I would say 95% of our clients have us mail them directly to the employees. In the welcome letter, it says, if you'd like to learn more about the plan, here's a toll-free number you can call to learn about the plan. So if they want to get educated on how to use it, they're welcome to call. We have bilingual operators standing by. They're calling our headquarters in Austin, Texas. We don't outsource this to some third party in Bangladesh, which obviously frustrates most people. So they're speaking to people who work for the Boone Group. They're our employees and are there to help explain and answer questions for your employees. So I think that's my summary.
Well, thank you, Brad, and thanks again for your time helping us out today. And just a final thank you for everybody who attended. Realize you're taking time out of your busy day to be here with us. What I want to do to conclude the webinar is just put our contact information up there, again, for payroll systems, as well as Brad at the Boone Group, as well as Eddie Murphy, our contact at Transamerica. So I'm going to leave that on the screen for a couple of minutes here, and then we will formally conclude the webinar. So thanks again for everybody, and we look forward to hearing from you. Feel free to contact us on this topic. Any questions, any comments, just to get more information on the subject of San Francisco Healthcare Security Ordinance.